Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Malika Thomas, an economist at the Brookings Institution, about the impacts of extended unemployment benefits during the pandemic on the economy, on workers, and on COVID rates. Let's listen.
Malika Thomas, thanks so much for joining me.
Thank you so much for having me.
So I'd like to talk about unemployment benefits and the pandemic, really sort of how this all came to be and who it has benefited and how. So talk to me about these, just very briefly, about increased unemployment benefits during the pandemic.
Yes, the increased unemployment benefits was really intended to help the more than 40 million newly unemployed Americans. And, you have to remember this is 1/4 of the entire U.S. workforce who, by the end of May 2020, had lost their jobs due to the pandemic. And the basic idea of why we needed expanded unemployment benefits is that unemployment generally goes through your state unemployment agency, and states vary enormously in terms of the rules that govern how people can qualify for benefits, how much they'll get, and how long they can collect them. Most states aim to replace around 50% of an unemployment worker's previous earnings, but states vary a great deal in what's known as the replacement rate, or the fraction of the previous earnings that the unemployment benefits replace. So, in general, states with the least generous unemployment benefits tend to be in the South, like Louisiana, Mississippi, Tennessee, North Carolina, and some of these places, including Florida, are particularly notorious because they capped benefits at a level that was under $300 per week nominally. So even with increases in the cost of living, unemployment benefits in many of these states have not risen for a long time. So one of the important parts of the federally expanded unemployment benefits, the CARES Act, which was signed into law in March of 2020, was the largest aid package in history. But it also helped to a large extent ensure that everyone in all parts of the country, regardless of the state in which you lived, was getting adequate unemployment benefits. So whatever level of unemployment benefits you were getting before through your state unemployment system, the CARES Act tacked on an additional $600 per week in unemployment benefits.
So we've heard that, we understand that some people were drawing $900 a week or more during this time, which is more money than they may have made previously. Did this cause a disincentive to work?
So it's definitely true that a lot of people, there are different estimates, but some estimates show 1/2, some estimates show that 2/3 of workers were receiving unemployment benefits that were greater than their prior earnings, and 1 in 5 getting twice as much as they made in their prior job. So clearly workers were benefiting from that. But, to examine whether there was a disincentive to work is a bit more complex. There was definitely a claim that more generous unemployment benefits might disincentivize work, but there seemed to be a difference between what was predicted by economic theory and what actually happened. A report, for example, by Yale economists assessed this claim and showed that there was very little evidence. They say no evidence that more generous benefits disincentivized work, either at the onset of the expansion in unemployment benefits or as firms looked to return to business by midsummer 2020, they found no evidence of a disincentive to work. And they assessed this claim by examining the differences in employment and the return to work among workers who received more generous unemployment benefits than others. And they found that the workers who experienced larger increases in unemployment benefit generosity did not experience larger declines in employment when the benefits expansion went into effect. They also found that workers facing larger expansions in unemployment benefits returned to their jobs in midsummer of 2020 at similar rates as those who received smaller expansions in UI benefits. They do note, though, that the context may be different. They were examining midsummer of 2020. They do note that the context might be different when states are ready to reopen and the vacancy to unemployment ratio starts to increase. But there were a variety of studies, including researchers who looked at checking accounts and bank accounts to look at the rates at which people were exiting unemployment benefits as these federal supplements started to expire. And if you think that the $600 per week supplement was deterring or disincentivizing work, you would expect to see that right around the time that the $600 per week expired, that you would see a lot of exits from unemployment right around this expiration. But the studies that have investigated this don't actually see that. They see a lot of people either returning to work far earlier than the expiration date, and in the window of time right around the expiration date, they only see a very short-lived and modest increase of about 3.5% right around when the $600 per week federal supplement to unemployment expired. In other words, they did not actually observe a large discouragement or disincentive to work effect based on the $600 per week supplement. So it really showed that in general, the cost of searching for a job during a pandemic was really, really high, both because the labor market wasn't good and unemployment was high, but also because it was a public health crisis. And it did not appear that the unemployment benefits had, or the expiration of those benefits had a large effect on whether workers were returning to work and how quickly they were doing so.
I mean, I guess part of this is we actually wanted people to stay home. I mean, so these benefits, do we think this contributed to fewer COVID cases when people had more generous benefits?
Right. So there's an additional aspect here, which is that this recession, we have to remember, is different than a lot of previous recessions in that it started in the real economy. It started because we as policymakers asked people to stay at home for the sake of people's health and safety and in order to save lives. So there's an additional aspect here, which is that a disincentive to work can actually be a desirable feature during a pandemic. The expanded unemployment benefits of the CARES Act and then later of the American Rescue Plan Act is often described as generous because the federal government gave Americans an unprecedented amount of money, which spawned concerns about a disincentive to work. But it's important to keep in mind why we asked people to stay at home in the first place. And we asked of the American people to take on what's really a very costly, expensive thing to do that was in the best interest of the public and of their fellow citizens and their neighbors. And we were asking people to essentially dig deep into their own pockets to do something that jeopardizes their own financial and economic security. And to be honest, at a more basic level, their food security and having a place to live in order to do something that is in the best interest of the public at large and in the best interest of their communities. And so it was really a public service that we asked of people, and a very expensive public service. And it should be treated as such. So on one hand, even though, some of the main reasons for increasing unemployment benefits during the pandemic was a basic aspect of relief because so many people lost their jobs, on one hand, we needed to cushion people and businesses from the immediate fallout. On the other hand, it's more than just the fallout. We specifically are asking people to take on an action that would help other people. And there's, this goes beyond what benefits themselves. While staying at home does offer safety to the individual person doing it, what I found through my own research and analysis is that more than 99.9% of the benefit of staying at home, which may involve turning down a risky job in order to do so, actually goes to the public, actually goes to society at large.
Mm-hmm. Because there's less spread of the disease.
Yes. If you even look at, average rates of transmission during April and May of 2020, while staying at home may or may not affect the individual person doing so, if it reduces their likelihood of becoming infected, it also reduces the likelihood that the future 4,000 people who would have been infected within 3 to 4 months, those infections would also be reduced as a result of that single person staying at home. So it's just due to the nature of exponential growth and the rates of transmission of the COVID-19 pandemic that any action you take that benefits yourself also benefits your community, and actually to a much larger extent than it benefits yourself.
So these federal unemployment benefits are going to expire any moment now. I know some states have already eliminated them. What do you see as the impact of that on working people?
Yes, so the federal government benefits are set to expire. There's definitely a different situation in the current period than there was in the beginning of the pandemic. In the early stages of the pandemic, the number of job vacancies were very low. So applicant to job vacancy ratios were quite high. Now there are actually more job vacancies than the number of unemployed people. So it's a very different situation now. However, there's still a risk associated with working. And the Delta variant is, of course, extending and prolonging the effects of the pandemic. So, of course, all of the benefits that arose from providing unemployment benefits are really going to be partially undone, but partially mitigated as we're, coming towards the end of the pandemic.
Mm-hmm. So what you're saying is then, just to clarify, that the economy is ready now, perhaps, for people to come back to work?
There is still a benefit to the fact that not everyone has returned to work immediately. And while there was a lot of surprise that the jobs numbers in April and May of this year were not higher than they were, there is still a risk associated with working. Of course, as the vaccination rates across the country have increased, the risks associated with each person working to their surrounding communities has gone down dramatically. However, there is still a benefit to the fact that the return to work has been slower than was otherwise predicted. So, what I found through my own research is that the majority of workers who are searching for jobs are still searching for work that can be done at home. But only 1 in 10 of the job postings in the first half of 2021 were for work that could be done at home. And at least early in 2021, what I found was that the jobs with the greatest number of vacancies were not necessarily occupations that had low rates of transmission. Some of these occupations were the ones with the highest rates of transmission. So there was a benefit to the fact that there was a slow return to work, and that seems to be, that effect is also going to be undone as the supplements to unemployment benefits expire.
One last question. What kind of impact on the economy do you think we're going to see when federal benefits are zero?
So it is definitely a difficult situation that the benefits are sort of structured as a cliff rather than a gradual decline. I had long been a proponent of a gradual decline where unemployment benefits were phased out, as vaccination rates in a county increased. So inversely in proportion to the vaccination rate of a county, so that as the effect of going out to work had less and less impact on your neighbors and surrounding community, that the structured disincentive to work would also decline. And an advantage of a gradual decline is first, what it allows to happen is that not everyone has to return to work at the same time. And presumably that means that the people who can do so first would be the people who can do it at the least cost. And this may mean people who either have fewer childcare requirements or needs. Maybe the people who can return to work first would be the people who don't have elderly members or immunocompromised members of their family living at home. And so if you had some element of choice involved in the unemployment benefits and a gradual phasing out of such unemployment benefits, you could have the people who could return to work at least cost do so first. And we have to remember that, close to 1/3 of the workforce has a child under the age of 14, and more than 1/10 of the workforce would have to remain at home so that each household with a child under the age of 14 would have at least one adult at home. So it's a difficult thing for families to suddenly approach a point where everyone needs to return to work at the same time, because the actual cost to supplying that labor is still high. It may be better than it was in the beginning of the pandemic, since transmission rates are lower and vaccinations are more widely available. But it is still costly in a real way. There's a real underlying cost to people being able to supply labor to the same extent that they were before the pandemic.
Malika Thomas, thanks so much for joining me.
Thank you very much for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.